take into an entire nest egg. And it all starts as soon as 9:30 a.m. tomorrow. Hello, this is Jeff Brown. Thank you for joining me on this urgent briefing. I've been a high technology executive for 3 decades, but I've never sent you such a time-sensitive message before. That's why I'm speaking to you now from a small studio right here in my hometown. No film crew, no suit and tie, just bare bones audio equipment. There are literally only hours left to act. I've dropped everything, made it priority number 1 to get you all the facts before it's too late. This special situation is rare, but when this situation does occur, and I'll prove that it could at 9:30 a.m. tomorrow, it will ignite the fastest and largest gains in stock market history. Over the first 24 hours, it's possible to see gains up to 1,000%. Over the next 12 months, gains of 3,277%, 5,940%, or 10,645% are not out of the question. I can't promise this outcome, of course, but it has happened before. This situation makes it possible to walk away with more than most people have in their nest egg in under a year. No, this isn't a private placement or an IPO. This is a wealth creation event unlike any other. A new cure. I invited you here today to bring to light one of the most powerful medical technologies of the 21st century, and that is according to Bill Gates. He's not alone. Dr. Eric Lander is president of the Broad Institute of Harvard and MIT. He went on 60 Minutes and agreed. They're talking about CRISPR, the genetic editing technology. By now, you've seen the news stories. You know that CRISPR is revolutionary. You know that doctors believe it could cure all inherited diseases and even cancer. But here's the thing. The media is also reporting that we're years away from CRISPR curing actual patients. They're wrong. Today, I'm going to share with you a major revelation. Understand, to 99.99% of people, what I'm about to tell you is a complete secret. Frankly, it's a secret to the most connected experts in both medicine and finance. Quite simply, one company has finally succeeded. Even more incredible, this isn't a big pharma giant. It's a small cap stock formed by 5 modern-day Einsteins. They first discovered CRISPR nearly a decade ago. Together, they've created a brand new CRISPR treatment that's proven so effective, the FDA has already given this cure the green light through an obscure rule few understand. Meaning, this small cap is using their CRISPR cure to save lives. Right now. Today. And the mainstream doesn't realize it yet. The only reason I know about this is I saw something I wasn't supposed to see. More on this momentarily. As we speak, the small cap is quietly treating patients in trials at our nation's top clinics, from Harvard's very own hospital to the prestigious Kellogg Center. During this time-sensitive broadcast, I'll show you how this company's CRISPR treatment could ultimately cure 6,000 types of diseases and cancers. Right at this moment, they're focused on one of mankind's most devastating diseases: blindness. That's correct. This small cap could already possess the cure to the most common form of inherited blindness, and 99.99% of people have no clue. One insider who does, this doctor, he's the CEO of the Foundation Fighting Blindness. He calls this new cure life-changing. This is a fast-moving situation, and it's why I requested your immediate attention. News of this cure will not stay hidden for long. It never does. And the one-day gains can be extraordinary. NBY, 875%. IMUN, 800%. ATNM, 900%. No one has a crystal ball, But for reasons I'll soon explain, when the market opens tomorrow at 9:30 a.m., this small cap, with the possible cure to blindness, could start to skyrocket too. In other words, there's a chance to see up to 10x gains in a single day, but only if you make your move now. And that's just the start. Because when a company creates a new cure, the profits are enormous. TGTX shot up 3,277%. QURA up 5,940%. And TXMD 10,645%, all in the space of 12 months. I told you, a new cure is a wealth creation event unlike any other. Gains like these are typically impossible to predict, but today is a rare exception. And if you make your move in the next few hours, you could be richly rewarded. Delay any longer, however, and it will be too late. Tomorrow, this story could be on the front page of the Wall Street Journal. The talking heads on CNBC will be stunned, trying to get a grip on why this small cap soared suddenly out of nowhere. I already know why. It has to do with a coming announcement from this small cap. I guarantee it will happen. That bears repeating. I 100% guarantee this announcement will take place. And those who make one move before that happens, the exact move I'm going to detail during this broadcast, their financial life could change forever. Will you be one of them? I certainly hope so. As an investor, I live for these types of surefire opportunities. Moreover, as a father of a son with a medical condition, these kinds of life-changing breakthroughs inspire me. It's truly a win-win situation. That's why, behind the scenes, I've been pulling strings. I had to call in several favors to rush this urgent presentation to you in time. In fact, my publisher asked me to delay it. They wanted me to do a big, polished online event about it, but I told them this cannot wait. Of course, you may be wondering, how can I be so sure? How can I guarantee this small cap's announcement is imminent? More importantly, how can I know up to 1,000% gains are up for grabs starting as soon as tomorrow, with vastly more potential profits set to come in the months ahead? For once, you can thank the FDA. This small cap must make their announcement. It's mandatory by law. Please pay close attention to what I'm about to say, because I'm going to explain everything right now. Earlier this year, I attended a closed-door meeting in Cambridge, Massachusetts. That may surprise you. Cambridge is home to Harvard and MIT. If you're a reader of mine, you know I spend most of my time at Yale and in D.C. In addition to holding both undergraduate degrees and graduate degrees and certificates from Purdue University, Stanford University, and London Business School, I recently became an alumnus of the Yale School of Management. Here I am with the dean. In D.C., I'm an active member of the Chamber of Digital Commerce. My position grants me access to private meeting with central bank heads, senior officials of the Department of Commerce, as well as the Pentagon and Department of Defense. In short, I operate on the inside, and that's what I was doing in Cambridge, getting in on the inside of the biotech industry. Cambridge has been called the center of America's biotech industry. There, I gained access to an exclusive roundtable on the future of CRISPR. CRISPR allows you to edit disease out of the body as if you pressed delete on a computer. The scientific community has described it as a miracle that could cure mankind's most devastating diseases. Alzheimer's, Huntington's, sickle cell, malaria, cancer, HIV, you name it. It could save millions of lives, as Bill Gates put it. But so far, this miraculous technology is only known to work in the lab. At Temple University, researchers used CRISPR to edit HIV out of T cells. In the UK, researchers edited malaria out of mosquitoes. I've seen amazing progress. But when will it work in humans? Conventional thinking says we're 5 years away. But what I witnessed at that closed-door meeting in Cambridge changed everything. Several key executives from the small-cap stock I've been telling you about were there, including the chief scientific officer. Obviously, the executives have to be tight-lipped about what they say in public. But what I heard shocked me. I can't tell you exactly what they said because it was a closed-door event. It has to remain a secret. But based on what I heard, I have 100% conviction this small cap could be in possession of a true cure for genetic blindness, specifically LCA10, the most common form of childhood blindness. Please, take a moment to consider what this means if they really have the cure. For the very first time, individuals who have been robbed of the gift of sight their entire life will be able to see. They'll enter the hospital, they'll receive this CRISPR cure via a simple injection, and they will walk out with near perfect vision. Initial tests indicate 90% clarity. Imagine never being able to see your spouse, your children, nature, and then with one CRISPR shot, you open your eyes and your blindness has vanished forever. Forget describing this as a miracle. It sounds more like science fiction, and I wouldn't blame you if you thought it was just that. But as the co-discoverer of CRISPR and founding member of this small cap has said, this is no longer science fiction. The end of genetic blindness may be the biggest medical story of our lifetime. However, I estimate 99.99% of people do not realize the cure could be here. But that's about to change. Starting as soon as 9:30 a.m. tomorrow, this cure could be thrust into the spotlight. And the biggest medical breakthrough of our generation could turn into the biggest money-making opportunity you've ever encountered. This is a millionaire-making opportunity. And tomorrow, it could kick into high gear. You could see up to 1,000% gains in a single day. The answer why is on your screen. This is government document NCT number 03872479. It's an official record of this small cap's new CRISPR cure for blindness. Outside of FDA officials and top-level biotech executives, no one's seen this before. In fact, I only just got my hands on it. When I gained possession of this document, I knew I had to contact you immediately. What this document brings to light is this. The FDA has designated this small cap's blindness cure an IND. An IND is a very special designation. It's like a fast pass. This small cap now has permission to use their CRISPR cure for blindness on patients via clinical trials, not years down the road, today. An IND, short for Investigational New Drugs, also comes with a stipulation. To get IND clearance, a biotech must agree to report trial results. It's not optional. In the FDA's own words, the submission of data is required. It's mandatory by law. This is massive. Why? Because reporting trial results sparks a special phase in a biotech's life cycle. I call it Stage 1. Take Sarepta Therapeutics, for example. On your screen is a snapshot of Sarepta on one specific trading day, October 3rd, 2012. This is when they first reported trial results, and the result is clear. Sarepta shot up 200%. This is a chart of my metrics. On December 1st, 2016, they reported trial results and entered Stage 1. Their shares skyrocketed more than 400% in the space of a day. And here's Equinox Pharmaceuticals. You can see that it was moving sideways, stuck at $2 a share, but suddenly on August 10, it leapt up to $21 a share. In other words, a 1,100% gain. That turns every $10,000 into more than $100,000. What happened? Equinox entered stage 1. You see, biotech stocks don't move based on fundamentals or a new cure, at least not at first. The movement of their share price comes in stages. It's like they're pre-programmed. And here's when stage 1 is programmed to happen, when a biotech reports trial results to the FDA. The biotech space is not a free market. The FDA decides the winners and losers. Reporting positive results to the FDA, that's the golden ticket. Immediately after, a biotech will enter stage 1 and explode. Look at Viking Therapeutics. On May 29 last year, Viking entered stage 1 and doubled in value. The media put it this way: Viking Therapeutics is on fire today. Of course, by the time you read news like this, it's too late to capture this one-day, 100% gain. You have to make your move before a biotech reports to the FDA. Here's Vitali Biopharma. After positive test results, Vitali's CEO reported their leading drug could gain expedited FDA approval. Stage 1 began. In one day, a $10,000 stake could have transformed into $115,000. The month after Vitali popped, another biotech entered stage 1, Orgo. Their clinical results launched the stock up 512% on January 9. Here's the deal. 99 out of 1,000 investors never encounter gains like these because you have to make your move before a biotech reports to the FDA. And mark my words, it's about to happen again. This small cap with the possible cure to blindness will be next. Because, like I said, the golden ticket to a biotech entering stage 1, where it has the potential to soar up to 1,000% in a day, that golden ticket is reporting results to the FDA. And this small cap, by law, must report their results. It's mandatory. The mainstream media has no clue. They'll be late to the party as usual. Not you. You know that this small cap is prepared to enter stage 1 and take off. It could report 100% or more in a day, like VKTX 101%, SRPT 200%, or CVSI 379%, or roughly 500%, like TGTX 566%, AMAR 600%, NBY 875%. Even 1,000% gains, while extraordinary, would not be impossible. BSEM 1,130%, HROW 1,288%, or AXIM 1,762%. Of course, no one can predict how high, but here's what we can say for certain. This small cap must report to the FDA. It's a concrete fact. And when they do, they'll enter stage 1, setting you up to potentially 10x your money quickly. Personally, I think it could be as soon as tomorrow at 9:30 a.m. In fact, as I'll explain in just a moment, I'm willing to guarantee it. Of course, if you're like me, you need more than a guarantee. You need actual proof. So take a look. Here's what the FDA says. IND drugs will be accurately and rapidly reported to the agency. In other words, the answer is this small cap must report trial results ASAP. I'm urging you, make your move now before it's too late. Insiders certainly are. A consortium of 14 of the world's savviest biotech investors are all in on this small cap, including the former science advisor of the world's richest man, Bill Gates. All told, they've invested over $100 million. Listen, you do not want to bet $100 million on a long shot. These heavy hitters know this small cap, with a possible cure to blindness, will report results, enter stage 1, and soar exponentially in price starting as soon as tomorrow morning. It's time you join them. I put together an urgent briefing titled The Cure. Inside, I pull back the curtain on this small cap, its name and ticker symbol, full details on its trial to cure blindness, everything you need to know before 9:30 a.m. tomorrow. At the sound of tomorrow's opening bell, this stock could begin to soar, allowing you to potentially see gains up to 1,000%. But let me be clear, I believe 1,000% gains are just the start. If my insider network is correct, this small cap could be the opportunity of a lifetime. Over the coming year, it has the potential to make 10x gains look small. And it's all due to something I call Stage 2. As I explained earlier, biotech stocks are essentially pre-programmed. In Stage 2, you can potentially make more money than most people have in their nest egg, all in the space of 1 year. But in order to enter Stage 2, a biotech needs the real deal, a true cure that works. When they have that cure, they'll automatically move into Stage 2 of their programmed life cycle, which is an explosive move to the upside over the course of 12 months. For instance, CV Sciences, their expertise, synthetically formulated CBD medicine. No doubt you're familiar with CBD. You see it everywhere today. What you may not realize is it's currently being used to treat serious medical diseases. The FDA just approved a CBD treatment to treat epilepsy. In short, CBD is clinically proven to work. And again, when something truly works, it takes off and doesn't stop. In Stage 1, CV Sciences jumped 277% in 1 day. Now, look at Stage 2. CV continued rising after that explosive 1-day move. Over the next 12 months, it soared 8,150%, enough to turn a $10,000 stake into $825,000, all in 1 year. Or take Chiron Life Sciences, for example. In Stage 1, it popped 400% in 1 day, and then they received federal approval to manufacture and sell an innovative dermatology treatment. In short, their treatment worked. Stage 2 had begun. From May 24, 2018 to March 18, 2019, Chiron shot up 3,180%, snowballing a $10,000 stake into a $300,000 nest egg in roughly a year. Incredible as those gains are, they can even get bigger. Consider Therapeutics MD. They developed the first and only FDA-approved treatment in its category. Shares catapulted 6,147% during Stage 1. $10,000 could have grown into over $610,000 in a single day. That's correct. If you knew about Therapeutics MD before it hit Stage 1, like the small cap I've been telling you about, you could have pocketed over $500,000. I want you to understand, all investment carries risk, and the biotech sector comes with tremendous risk, so you should never invest more than you're willing to lose. But the rewards of backing a company with a true cure can transform your finances radically. Look at Therapeutics MD immediately after Stage 1. It hit Stage 2 and soared 10,645% over the following 12 months. A $10,000 stake could have turned you into a millionaire in the space of a year. I'm telling you all this because I'm confident that this small cap will not only report results and enter Stage 1, I'm certain they have a true cure to genetic blindness, setting them up to rocket into the ultra-lucrative Stage 2 level over the next 12 months. To explain, I need to take you back to the closed-door roundtable in Cambridge. As I mentioned earlier, executives from this small cap, including the chief scientific officer, were in attendance. Sitting in that room, I was shocked at what I heard. Again, I can't tell you what was said. It must remain a secret because, as you can imagine, you don't become a high-level insider by revealing high-level conversations. But here's what I can tell you. Sitting there, listening to the executive speech, I was reminded of Steve Jobs unveiling his last Apple breakthrough before he passed. You see, the executives of this small cap are privy to information unavailable to the public. In short, they've actually seen this technology work in the lab. They've edited out the genetic mutation using their CRISPR technology, and it worked. They corrected it entirely. Efficacy has been proven. That's why trials are taking place at 4 of the most distinguished hospitals in the country as we speak, including the Kellogg Center, Harvard's Massachusetts Eye and Ear, institutions with a history of launching some of the biggest treatment breakthroughs. Only 5 in 5,000 drugs ever advance to human testing. That's less than 0.1%. In short, this treatment has already made it further than 99.9% of those the FDA approves for testing, and further than any other CRISPR treatment in the world. Also, their treatment works better than any other in the CRISPR space. They pioneered a new kind of method for putting CRISPR to work in the human body. It's called in vivo. In vivo is a Latin term that literally means in a living thing. Up till now, CRISPR trials have been ex vivo, meaning they take place outside of the body. To make a long story short, ex vivo does not work accurately when used on the human eye. Cells are extracted from the blood, modified using CRISPR, and only then infused back into the patient's eye. It's complicated. It's time-consuming. And frankly, the results have not been as promising, especially for vision-related diseases. In fact, overcoming the ex vivo hurdle has been described as a moonshot by the National Eye Institute, a goal they don't expect to reach until 2025 at the earliest. It's one of the reasons why, if you asked your doctor about a CRISPR treatment, they would politely chuckle and tell you to check back in 5 years. But like I mentioned, this small cap has figured out a way to deliver CRISPR directly into the body to cure genetic blindness, using what's called an in vivo treatment. It's as straightforward as getting a flu shot. And it could wipe out the most common causes of inherited blindness in children. With a simple injection, this small cap's CRISPR cure cuts out the existing genetic mutation and repairs the DNA in the blind patient's retina. In other words, just one shot could let them see in a matter of days. It's profound. These people have been blind their entire life. Now, one shot could hold the cure. And by the way, executives from this small cap are not the only people who think so. Dr. Ben Yerxa is one of the brightest minds in medicine. He has 20 years of experience with a focus on ophthalmology, eye diseases, which is why he's the CEO of Foundation Fighting Blindness. When asked about this small cap's new CRISPR cure for blindness, he said simply, "It's potentially life-changing." Tom Barnes is a senior VP at Intellia, a direct competitor of this small cap. When he was asked about this type of in vivo CRISPR treatment, he said, "It works just as advertised." Are you beginning to see why I dropped everything to speak with you today? After it hits stage 1, as soon as tomorrow, this small cap is in perfect position to thrust immediately into stage 2. And the gains in this stage are enormous. KHRN, 3,180%. TGTX, 3,277%. CURA, 5,940%. CVSI, 8,150%. AXIM, 8,948%. TXMD, 10,645%. and CURE 32,700%. However, I'll remind you once again, if you wait until the mainstream media catches on, it will be too late. You'll miss stage 1 entirely, as well as a big chunk of stage 2, if you don't act now. That means you could be leaving the opportunity to see up to 10x gains on the table and lose the chance to potentially walk away with a nest egg over the coming years, depending on your starting stake. This is why I put together The Cure. It's the briefing I mentioned earlier. The intel inside will ensure you don't miss out. The moment you open up this report, you'll see the name of this company and their ticker symbol. If you make your move now, there's still time to get in before the market opens tomorrow. In a moment, I'll give you instructions for getting your hands on The Cure. Before I do, there's something else you need to know. Stage 1 and Stage 2 are not the end-all to be-all. There's a final stage, and it's by far the most lucrative. Take Pfizer, for example. They tackled the big health problem of high cholesterol and heart disease with their drug, Lipitor. It became the world's most successful drug with lifetime sales of over $150 billion. And it was one of the big reasons Pfizer could have showed investors a 50,700% peak gain, enough to turn $10,000 into over $5 million. You see, when a company has a real treatment and a strong team of executives and scientists, the gains can grow exponentially over the years. I call these long-term gains Stage 3. Consider Abbott Laboratories, for example. Their breakout drug was Humira. It's used to treat different kinds of arthritis and Crohn's disease. It's become the second best-selling medication in history. As a result, Abbott Laboratories reached a peak gain of 196,400%, snowballing a $5,000 stake into over $5 million. Phenomenal growth. Then there's Amgen. Their drug, Enbrel, is one of the biggest of all time with over $108 billion in sales. It treats people with rheumatoid arthritis and psoriasis. Amgen returned at its peak 163,100%, multiplying every $1,000 into over $1.6 million. Yes, even a tiny $1,000 stake would have made you a millionaire. Here's Gilead Sciences. They launched a drug named Sovaldi to treat hepatitis C. Over time, investors could have seen a peak gain of 35,400%. Then there's Biogen. Their drugs, Avonex and Tecfidera, treat people with multiple sclerosis. And thanks to them, in less than 6 years, investors could have been rewarded with peak gains of 95,700%. Yes, these examples are extraordinary, but these kinds of life-changing gains are what's possible in Stage 3. When a company has a real treatment that gets real results, led by a strong executive team with experience, this small cap with the possible cure to blindness has this expertise in spades. I briefly mentioned it earlier, but this small cap was founded by 5 pioneers in the genome editing world, including a PhD from the University of California, Berkeley, a PhD from the Broad Institute of MIT and Harvard, a PhD and professor of genetics at Harvard Medical School, an MD and PhD at Massachusetts General Hospital and Harvard Medical School, a PhD and professor of chemistry and chemical biology at Harvard University. I could rattle off their credentials and accomplishments for the next hour. These people are the Einsteins behind CRISPR technology. They originally discovered CRISPR back in 2012, and now they're the brains behind this small cap company. And if you really think about it, is it surprising that the first scientist to discover CRISPR would be the first to create a working CRISPR cure? What's more, the cure for blindness is just the start. According to one of the founders, there are about 6,000 or more diseases that are caused by faulty genes. The hope is that CRISPR will be able to address most, if not all of them. Diseases like cancer, MS, cystic fibrosis, Huntington's, and ALS, to mention a few. In other words, the potential pipeline of treatments using CRISPR technology would number in the thousands. During my entire 3-decade career, I've never seen a biotech better positioned to hit stage 1, 2, and 3. And billions are already swirling around. Consider this: the global gene editing market is expected to reach $9.6 billion by 2025, according to Zion Market Research. William Credell, managing director of the Fergana Partners, says, "In my 40-plus years of banking, I simply have not seen a single technology with the potential to so completely and thoroughly revolutionize the field of medicine, and by extension, play such a large role in financing and deal flow for years to come." It's happening now. This small cap's CRISPR cure could change the lives of countless people. Maybe even a family member or friend now suffering from blindness, cancer, or another uncurable disease. Like I said, this is a truly win-win situation, both as an investor and as a father. And soon the whole world is going to know as soon as this small cap reports their blindness trial results. Of course, by the time they report and news of this breakthrough gets out, it will be too late to act. Most people are going to miss out on gains of up to 1,000% in one day and the chance to create an entire nest egg in the next 12 months. But you won't if you don't act immediately. Tomorrow literally may be too late. So here's what I'm going to do. Say the word, and I'll email you a copy of my brand new briefing, The Cure. Inside, you'll find everything you need to know so you don't miss this opportunity. The name of this company and its ticker symbol, as well as critical information for understanding how it could move through stage 1, 2, and 3 in the months ahead. This may be the most important briefing of my career. If not the most important, perhaps the most potentially lucrative. I've spent at least 5 years hunting down the intel inside, which is why what I'm about to say next may come as a surprise. I want to send you The Cure for free. It's part of a bold venture I'm spearheading known as Exponential Tech Investor. I designed Exponential Tech Investor to solve the biggest problem I faced here during my time as the editor of the Near Future Report and as the chief technology analyst at Bonner and Partners. A problem that involves you. In short, I can't share the best tech opportunities with you. I'm handcuffed. Take the Near Future Report. To my knowledge, it's the most widely read technology newsletter of its kind in America. Subscribers have already had the chance to get in on amazing opportunities, including the #1 stock in the S&P 500 in 2018. But at that same time, they've missed out, and you've missed out, on tens of thousands of percentage gains. Why? Simply because I have to recommend big tech companies to my wide audience. I can't share with you the tiniest, most explosive technology stocks, like this small cap biotech, for instance. If I gave the ticker symbol to my entire readership, it would dramatically inflate the price, and the majority of folks would not be able to get in at my recommended price. So I couldn't share these opportunities with you. Until now. Exponential Tech Investor solves this problem. Through this special venture, I can share with you the same types of opportunities only highly connected technology insiders like myself can access, and the substantial returns that can come with them. And they are certainly substantial. In fact, insiders like me are making up to 70 times more than the average investor, simply by targeting the early stage technologies and the small cap companies behind them. Have you heard of Lattice Semiconductor? Their semiconductors are in servers, missile systems, MRIs, you name it. It's big business. And this large tech stock is up 90% since 2017. Good, but not great. Say that you have heard about a small cap like Tandem instead. They developed a breakthrough technology for insulin infusion therapy. It's a godsend for anyone with diabetes. And after receiving approval from the FDA, you can guess what happened next. Tandem stock is up 6,366% in just 2 years. So on one hand, you could have invested in a big established tech company like Lattice and made a 90% gain. Or if you had the inside track in the tech world like I do, you could have targeted a tiny company like Tandem and made over 6,000%. And in this case, by choosing the early stage tech, you could walk away with 70 times more. Of course, typically you'd never hear about these companies until they're way past the early stage. Tandem, for example, is worth $3 billion right now. But Exponential Tech Investor fixes this problem permanently. It gives you access to the same types of early stage opportunities that have built my personal fortune. Right now, the opportunity I'm most excited about is this small cap with the possible cure to blindness, hands down. And as your welcome gift for joining me at Exponential Tech Investor today, I'm going to send you my briefing on this company immediately for free. But this is just the beginning. I have more welcome gifts to share with you because thanks to Exponential Tech Investor, I can help you get in on the tiniest, most exciting early stage opportunities in the market. And right now, the market is rife with such opportunities, more so than at any other time during my career as an angel investor and Fortune 500 executive. For instance, 5G. The Financial Times calls 5G a game changer for humanity, with Steve Mollenkopf, CEO of Qualcomm, saying it will have an impact similar to the introduction of electricity or the automobile. And billions of dollars are already flowing into this massive trend. Venture capital firm Greensill says the 5G market will soar to an estimated $2.7 trillion by the end of next year. And some estimates say it could be worth $17 trillion by 2035. Now, my Near Future Report subscribers have had a great opportunity to get in so early on the 5G cash cow. But again, many of the best stocks in the 5G space are so new and so tiny, I can't share them with everyone. Case in point, I recently came across a small company that's building a special component part for 5G devices with applications in smartphones, Wi-Fi routers, 5G base station cells, and military radar. This device is revolutionary. Based on my research, this small cap could shoot from zero revenues in 2016 to $140 million by next year. Sounds incredible until you realize the insiders driving this tiny company have a combined 80 years of experience in this space. I put all the details inside another trading report I'd like to rush you as well, called 5G Fortunes: How to Make a Fortune on the Next Tech Revolution. It reveals everything you need to know, including the full research and the name of the small company to grab now. And just like my urgent briefing on the small cap biotech, I'll send this report to you immediately. You can have both for free when you become my newest member of Exponential Tech Investor. So how much does a 1-year membership cost? Let me be frank, it's not cheap. And that's intentional. It's a premium research service best suited for a specific type of investor, namely someone who wants to profit from small cap stocks on the verge of exponential growth. This service is essentially you looking over my shoulder and seeing what's in my investing journal. My background as a tech executive and angel investor gives me unparalleled access to early-stage technologies few ever hear about, until they make headlines in the Wall Street Journal. That's why a 1-year membership costs $4,000, A bargain when you consider the kinds of opportunities I'll be sending your way. Just one of my picks could pay for your subscription many times over. But don't take my word for it. One of my readers wrote in to say, Jeff, I just wanted to say thank you for your Monday morning recommendation to buy Lamb Research. I made a 54,000% annualized gain, my best trade ever by far. Listen, notes like those never get old for me. I love seeing people use my advice to change their financial life. And I believe the opportunity that's front and center with you right now, eyeball to eyeball, is a genuine shot at transforming your wealth. I want as many of my readers to take advantage of this immediately. So here's what I convinced my publisher to do. In short, you won't have to pay anywhere near $4,000 to access Exponential Tech Investor. You won't even have to pay $3,000 or $2,500. Frankly, the deal I've worked out is so generous and the situation with the small cap so urgent, my publisher is not only making this deal available on an hour-to-hour basis, in other words, it may not be here tomorrow. As I told you earlier, I've arranged a big discount for you, and here it is. You can join Exponential Tech Investor for 50% off, meaning instead of $4,000, you'll only pay $2,000 for a one-year subscription. But you need to act immediately. If you're watching this video right now, you still have time. You've seen and heard all the facts for yourself. This small cap with the cure to blindness could make history as soon as tomorrow. Here's your chance to make one simple move to perfectly position yourself ahead of the 3 profit stages and the life-changing gains. To quickly recap, here's everything you'll get for free when you act now. The Cure, the small cap company with the cure to blindness and 6,000 other diseases. 5G Fortunes, how to make a fortune on the next tech revolution. The House of Tomorrow, Part 1, Inside the AI Revolution in Your Home. The House of Tomorrow, Part 2, How to Profit Off the Next iPhone. Each report details the name of a small cap, early stage investment which could 10x your money or more. These reports are your gift, free of charge, when you join my Exponential Tech Investor early stage tech service. Plus, every month, you'll get a new issue of Exponential Tech Investor. Inside its pages all unveil a new early stage tech stock I think is on the verge of explosive profits. With every recommendation, I'm looking to get in early enough that our gains are massive. The chance at 5 to 10 times your money, or even more in special cases, like with the small cap that could cure blindness. You'll also receive 24/7 access to a members-only website. Here you can review all your briefings and bonus reports, at your convenience, of course. I've also prepared an entire suite of video resources to help you hit the ground running, and you get all this for $2,000. That's a 50% discount. In other words, you save $2,000. That's a savings you can take to the bank, or even use to seed your first investment. For example, if you put $2,000 into the small cap that could cure blindness, and the stock shot up 1,000% during stage 1, that $2,000 seed money would grow into $22,000. And if this company has a true cure that works, as I believe, the gains could go even higher during stage 2. One of the smaller stage 2 examples I showed you shot up 3,180%. What if this small cap saw a similar spike? In that instance, a $22,000 stake would snowball into $721,600. More than most people's entire nest egg. But as I showed you, stage 1 and stage 2 aren't the end-all to be-all. Stage 3 is the most lucrative. And considering this small cap was founded by the 5 pioneers of CRISPR, has the green light from the FDA, and, beyond blindness, could use its CRISPR tech to help cure up to 6,000 diseases and cancer, well, I believe they could eventually enter stage 3. And we've seen peak gains of 95,800% in this stage. But let's be conservative and imagine this small cap climbs another 2,000% during this final stage. That would catapult your $721,600 from stage 1 and stage 2 into $15 million in stage 3. Yes, all from a modest $2,000 seed investment. Of course, that's an extraordinary example, and I'm not promising you'll walk away with $15 million. What I am saying is that in my 3-decade career, I've never seen a biotech better positioned to cash in at each stage. 500%, 1,000%, 5,000%, 10,000%. No one knows how high this small cap could rocket. There's only one way to find out. Just pull the trigger and join me on this opportunity. If you're still on the fence about it, get this. Your opportunity to ride shotgun with me on this once-in-a-decade small cap is backed by my 90-day, 100%, love it or leave it satisfaction guarantee. If membership to Exponential Tech Investor isn't right for you, please just give us a call. If you're not 100% happy and you contact us in the first 90 days, you'll get a full $2,000 refund credit you can use for any other product we or our partners publish. With that kind of guarantee, you can sleep easy at night knowing you made a smart decision. But I want to give you an extra incentive to join me right now, because most people are going to wait too long. It's human nature. They'll hesitate and miss out on this historic moment. So I pulled some strings with my publisher and I worked out a time-sensitive deal for you. In short, anyone who joins after watching this urgent presentation will get 2 very special bonuses. Bonus number 1, you get another year of membership free, a $4,000 value. That means when you order now, you'll get 2 years for just $2,000. That's a 75% savings off the regular retail price others would normally pay. But this is where it gets crazy, because I'm going to give you another special guarantee. One I've never made in all my years of doing this. In fact, I've never seen anyone in our industry ever offer their members this kind of guarantee. But here it goes. To reward you for acting immediately, when you order now, you'll get bonus number 2, a special, never-before-offered 100% conviction guarantee. I, Jeff Brown, 100% guarantee this small cap will follow FDA mandate and make an announcement regarding their human trial treatment to cure blindness. In fact, I'm so confident in this recommendation, if they don't make an announcement, I'll give you another year of membership for free. Yes, I'll work for you for free for an entire year and give you 12 full months of my expert investment recommendations completely on the house. I'm that serious. All told, you're covered by 2 ironclad guarantees and a huge 75% discount. So here's what I want you to do. Click through the order page to join and be sure to print out this guarantee and keep it in a safe place. Because if this small cap does what I think it will, it makes headlines, you can frame it and tell your friends and family about the time you invested in a tiny biotech with the cure to blindness before it made front page news around the world. It's one simple move, and it could change your financial life, all while partnering with a company that could change people's lives for the better. A rare win-win situation in my book. Here's what we're looking at. Either I'm right and you see up to 1,000% gains, or if I'm wrong and the company doesn't make an announcement, I'll work another year for you for free. It's your choice, but when's the last time you had the chance to make up to 1,000% in one day and build an entire nest egg in 12 months? Food for thought. This small caps treatment has already made it further than 99.9% of others. And out of 130 private companies I've personally invested in, I've been right 125 times, meaning that I have a 96% success rate predicting winners. The odds are stacked in your favor on this one, but you need to decide now. Look at your screen. You get all these welcome gifts and 2 years of Exponential Tech Investor for the price of less than 1. In other words, a 75% discount. And don't forget, I 100% guarantee this small cap will follow FDA mandate and make an announcement regarding their human trial treatment to cure blindness. In fact, I'm so confident in this recommendation, if they don't make an announcement, I'll give you another year of membership for free. Well, that's a wrap. Thanks for joining me on what may be the most important briefing of my career. Right now, you can make one move ahead of 99.99% of the investors out there. Hesitate and you'll miss out. Simply click the button below to get started. It will take you to a secure order form.